guys, welcome back to the Holistic Rehab Room. Today we are going to be going over osteoarthritis of the hip. Osteoarthritis definition, so it's a disorder of the synovial joints characterized by articular surface wear and tear and the formation of new bone in attempt to repair the damaged bone. So the osteoblast will come and try to lay new bone, and when the synovial joints are affected, that's when you can get the inflammatory responses to flare. Classifications. So there's different classifications of osteoarthritis. So you have primary osteoarthritis and secondary osteoarthritis. So the primary osteoarthritis is idiopathic. It's an idiopathic phenomenon, and it occurs in previously intact joints with no apparent indicating or initiating factor. Secondary osteoarthritis usually is as a result of predisposing conditions such as trauma, infection, congenital deformities, obesity, and also occupational stresses. So if you're doing work under heavy loads and things like that, and this adversely alters the articular cartilage and or the subchondral bone of the affected joints. Normal structure and function. So cartilage is a dynamic structure, and it consists of collagen fibers which are intertwined with proteoglycans, and the proteoglycans, the backbone of each proteoglycan complex is a long molecule of hyaluronic acid, which then has large aggregans attached by linked proteins. This provides the cartilage with the biomechanical properties of compressibility and elasticity. And healthy cartilage is in a state of balance between matrix synthesis and degradation. Now we're going to go over the pathophysiology, which is dynamic in nature. The cartilage degradation, there are two enzymes that are responsible for the degradation, and they are the matrix metalloproteinases and the aggrecanase. And the matrix proteinases, you have collagenase, which is a collagen degradation, and you have stromatolin, which is the proteoglycan degradation. And then you have the aggrecanase. So you have the ADAMTS5, which is a degraded aggregans and the proteoglycans. So you have cytokines. The cytokines and the growth factors are produced in the joint tissue and released into the synovial fluids. These factors are released in low levels and are required for normal homeostasis. The balance may be distributed in osteoarthritis. Next, we have the pro-inflammation catabolic cytokines. Interleukin and tumor necrosis factor are pivotal in the process of progression of osteoarthritis. These catabolic cytokines stimulate chondrocytes to degrade the surrounding cartilage matrix. Subchondral bone. Okay, so the osteoarthritis is characterized by the subchondral bone sclerosis, thickening of the cortical plate, the extensive remodeling of the trabeculae, and formation of new bone and joint margins, which is the osteophytes. During the progression of arthritis, the subchondral bone turnover is 20 times higher than normal bone formation. Due to biomechanical factors such as alkaline phosphate, osteocalcin, and osteopontin. The enhanced anabolic activity of subchondral bone osteoclasts can be seen by the formation of osteophytes. As osteoarthritis progresses, the subchondral bone becomes hard and eburnated. The lack of articular cartilage therefore increases friction and weight transmission through the joint. Synovial fluid may enter in the bone and cause subchondral cysts. It may enter cracks in the bone and cause subchondral cysts. Microfractures may occur. These heal and produce a callus which causes the bone to become harder and denser. As the condition progresses, joint space will narrow, further osteophytes are formed, ligaments become lax, leading to instability and deformity. The synovium. Synovitis is inflammation of the synovium. The synovial inflammation is due to release of cytokines, and inflammation affects areas of adjacent cartilage and bone. The activated synovium can also produce protease and cytokines that contribute to disease progression. Clinical features. So you have pain, reduced range of motion, stiffness, muscle weakness, crepitus, deformity, and loss of function. Pain. So the bone and joint capsules are richly innervated and can produce pain. Inflammatory response. The patients may complain of aching, which would be an initial symptom. Stabbing may relate to a loose body in the joint. Throbbing, possibly at night, related to the inflammatory response. Patients tend to have good and bad days or periods of time without pain, followed by a flare-up. Pain is related to movement and weight bearing. Pain is usually eased at rest. The pain may be localized or diffuse and may refer to other joints. Reduced range of motion occurs slowly due to the change in the shape of the joint surfaces. Muscle length may be reduced and is only noticed limitation of movement once they are restricted functionally. Stiffness often occurs following rest, loss of joint lubrication, and can be as a result of combination of pain, weakness, and reduced range of motion. Muscle wastage or muscle weakness. Muscles become weak and atrophy because of the pain or lack of use. You may even have muscle spasm, which is a protective mechanism and occurs to prevent further movement, as it is an involuntary contraction. Crepitus. This is the grinding of the bone ends. Deformity. So the joints become deformed due to the disease process, and patients adapt to their symptoms and may cause further problems in other joints. And this may cause further problems in other joints. During a flare-up, active inflammation occurs. Loss of function. Pain, reduced range of motion, muscle weakness will affect a patient's function. Functional limitations. So we're going to look at some of the functional limitations of osteoarthritis of the different joints. So the hip, you may have functional limitations with walking, going up and down the stairs, bending down, or moving from bending to standing upright, putting on socks, cutting your toenails. With your knee, you may have difficulty walking, taking the stairs up and down, or ascending and descending, putting on socks. And if you have osteoarthritis in your hand, you may have difficulty with ADL. So for instance, dressing, brushing your teeth, being able to put your shoes on, and things like that. So here is some medical management You have pain relief medication, local steroid injection, and surgery, so a joint replacement or a fusion. So you may have a total hip arthroplasty or a hemiarthroplasty, and that is all for osteoarthritis of the hip. I hope you guys enjoyed, and I hope you guys learned something new today. Thank you for watching. Please like, share, and subscribe.